Hi, and welcome to my YouTube channel. What do SIBO and Hashimoto's or hypothyroidism have in common? This is a pretty common question, and I work with a lot of people in my nutrition practice where this is true. My name is Sara Peternell. I'm the owner of Family Nutrition Services in Denver, Colorado. Welcome to my home. This morning I'm thinking about a really important subject. In fact, I'm working with a few clients right now where SIBO, or small intestinal bacteria overgrowth, we just call it SIBO for short, is a real problem. This is a digestive condition that I think sort of eludes many physicians and practitioners because it's hard to identify the root cause or really a treatment plan for helping people who have some of the symptoms of SIBO. So let's just talk about, first of all, what is SIBO? Small intestinal bacteria overgrowth is exactly what it sounds like. The small intestine does have some bacteria in it. It's supposed to, right? Our entire body is colonized with bacteria, and our digestive tract contains millions, billions, trillions of both beneficial and sometimes the not so good bacteria in order for our digestive system to thrive. What happens is when sometimes maybe slowed motility or other complications of the digestive system such as celiac disease, irritable bowel syndrome, inflammatory bowel conditions, or just other sort of malabsorption and malnutrition problems can lead to a big change in the overall intestinal bacteria makeup and numbers of colonies in the gut. So sometimes what happens is the bacteria that live in the large intestine and the colon migrate upstream into the small intestine where they're not supposed to be. So the small intestine bacteria overgrowth basically is a problem of too much of the wrong kind of bacteria in a place where it shouldn't be. So small intestine bacteria overgrowth, or let's just call it SIBO for short, but now we know what it is and where it is and how it can get there. But SIBO is a really common problem in a lot of the clients that I work with because they are experiencing potentially this slowed digestive motility, meaning the rate at which when they eat, food travels through their digestive system and reaches the end of the pipeline for excretion and removal of waste, going poop basically, meaning that this transit time is too slow and it enables a lot of the bacteria from the colon to start moving backwards. People who experience Hashimoto's and hypothyroidism have slowed motility oftentimes because of the slowed thyroid hormone production in the body, which is responsible for so many of the different processes and functions of the body, including the rate of our digestion. You've seen me talk in a lot of other videos about the role of healthy thyroid hormone production in thermoregulation and even in metabolism. Well, the same is true for how these hormones can help to regulate the normalcy of the rate of food passage through the body. All right, so we've established that if potentially you have Hashimoto's and you're dealing with hypothyroid symptoms that include constipation or not going to the bathroom on a regular basis, SIBO can be one of the results. But SIBO also has a component that is not related to constipation, and in fact, it may be related more to some of the IBS-D, or irritable bowel syndrome diarrhea-like symptoms. And again, because there are a variety of different sort of symptom patterns in a lot of people who have Hashimoto's or hypothyroidism and SIBO, it can be difficult for physicians and practitioners to figure this problem out. So I'm going to kind of give you some of the facts and information about how SIBO is connected to hypothyroidism and Hashimoto's. Basically, what we're talking about is that the symptoms of an underactive thyroid leads to disturbed digestion. All right, we kind of already discussed that. So this can lead to a change in the balance of bacteria in the intestine, which leads to overgrowth of this bacteria in the wrong place, or called SIBO. Disturbed digestion, diarrhea, constipation, these can be the symptoms of an underactive thyroid and can also be one of the symptoms of Hashimoto's or other sort of corresponding leaky gut IBS issues. So people who are at a greater risk of SIBO within especially the Hashimoto's population tend to be females and people who are older in age. I'll explain some of this more in just a minute. People who've ever used a PPI, which is called a proton pump inhibitor, or basically just like a reflux medication for heartburn and acid indigestion. This is typically like your Prilosec and some of the over-the-counter acid-reducing medications, even as basic as Tums, which can help to lower the hydrochloric acid in the stomach. Also, any individuals who've ever needed to take painkiller medication or opioids. So we know that there is a subset among Hashimoto's of people who experience chronic pain, fibromyalgia, and maybe even joint pain associated with a secondary autoimmune illness like rheumatoid arthritis, where certain types of pain medications may be warranted. People who have, again, irritable bowel syndrome, inflammatory bowel disease, other small bowel issues like diverticulitis, or intestinal dysmotility, or just that slowed motility through the gut. These are other people who may be at a greater risk of SIBO. Also, anyone who's had abdominal surgery. This can be a big piece of the puzzle too. When I'm working with my clients and I go through their health history, I work to understand with them if perchance at any point in their life, maybe they were hospitalized or received treatment or had surgery for their digestive system. This may have been one of the triggers that led to this complication along with their Hashimoto's. Other people who have conditions such as diabetes, heart conditions, pancreatic disorders, Parkinson's, and also some other random syndromes like restless leg syndrome and other skin conditions can be associated with SIBO as well. That's because a lot of times the bacteria that is in the gut that causes some of the SIBO-like symptoms can become systemic and also be playing a role in some of the systemic or bigger picture chronic health conditions long term. I'll explain more about that in just a moment as well. So SIBO symptoms, as I mentioned, can be really evasive and really can kind of elude most physicians and even for the patient themselves. So when I work with my clients, they may describe very irregular patterns of symptoms, which even as their holistic healthcare provider and being board certified in holistic nutrition, it can make it very difficult for me to kind of isolate some of these particulars. Some people may or may not have abdominal pain, and some people even may not have any digestive symptoms at all. But the most common symptoms are bloating. That one really is the biggest issue. I have another video all about bloating in Hashimoto's, and you can check that one out. That's specific to that condition. Gas. All right, so any of my clients where they're talking about sort of abdominal distension, lower abdominal pain with gassy sort of side effects, including flatulence and especially the really stinky gas that sometimes has kind of an egg-like odor, that can also be related to SIBO. But things that are less often thought of, belching and nausea, as well as weight loss or weight gain, and even things like mood changes, brain fog, and irritability, they can be related to SIBO as well. Now, standard treatment of SIBO, when working with your primary care doctor, a gastroenterologist, or your family physician, may recommend a course of antibiotic treatment. The standard antibiotic treatment is usually going to be a combination of things and may even include something like a flagyl, which is a pretty intensive medication, and it really works to destroy the overall bacteria in the gut, including not only the bad bacteria, but the good bacteria as well. And this can help some people who are experiencing really severe symptoms. But the problem is that without the appropriate holistic measures in place as well, guess what? SIBO might come back. So taking something like an antibiotic treatment may alleviate some of the symptoms and side effects from having SIBO, but basically research tells us that 4 out of 10 people receiving antibiotic treatment may actually not get better. In fact, they may get worse or develop chronic SIBO patterns where they basically are continually reactivating SIBO and kind of in like a 2 steps forward, 5 steps back type of a treatment program. So we know that SIBO has some ability in the gut to prevent the intestines from absorbing really important and essential nutrients. However, research has shown that taking any of the thyroid replacement hormone medications such as levothyroxine is not necessarily going to impact the absorption of that medication by having SIBO or vice versa. So right now, research tells us that taking medication doesn't inadvertently affect our ability to use that medication, and that SIBO doesn't necessarily impact the absorption of the medication. However, I can tell you from my clinical experience and working with my clients over the years that once SIBO is resolved, I've found that many of my clients are actually able to lower their thyroid hormone dose, or they just may feel better overall, like their medicine starts working better for them. So while so far limited research shows us that SIBO doesn't really play a big role in terms of how our body uses thyroid hormone medication, I would differ and say that the holistic approach of the dietary and lifestyle principles that help to kind of really resolve chronic SIBO can also have a really powerful effect on the ways in which we utilize our medication. Now, one of the things I mentioned a bit ago was that people who are at greater risk are women and people who are older. Now, I want to talk about these two things because perhaps if you fall into one of these categories and you're watching this video, you might be thinking, yeah, I've noticed this, right? Like I'm a woman and I'm seeing some changes in my body, maybe especially as you get older, but men and women, both as they get older, may be noticing more digestive changes, especially as it pertains to their Hashimoto's. So the first thing is that small intestinal bacterial overgrowth does have some relationship to the roles that our other hormones play in the body. And one of the things I found in a lot of my women clientele is that if they have digestion or detoxification complications, meaning that they are potentially estrogen dominant, which can certainly happen during childbearing years and also during perimenopause, estrogen dominance can be one of those things that can basically create some backup, if you will, in the liver and gallbladder, and it can also recirculate estrogen metabolites as well as other toxins through the enterohepatic vein, which is like a big portal vein that leaves the liver, and it is supposed to put the toxins and things directly into the colon for removal of that waste. But if a person is not going to the bathroom on a regular basis or has any other complications with bowel motility, well, then the digestive system is not being emptied, and so those toxins that are in the gut basically get dumped back in to the bloodstream. And so it's this complication with some of the hormone metabolites and toxins that are not being filtered and not being removed that may actually contribute to an increase in the bacteria of the large intestine and where it is able to travel in the digestive system, moving kind of slowly up towards the small intestine, thus creating SIBO. So women postpartum, having experienced big changes in their hormones after giving birth, also women who are perimenopausal or menopausal and are starting to have those normal fluctuations in both estrogen and in progesterone, especially maybe around the time of their cycle, may notice that some of their symptoms actually worsen. SIBO worsens around hormonal changes each month. So women, again, our cycles and our hormones have a very big impact on that real estate, that common real estate that it shares down with the digestive tract. Making sure that you're getting plenty of fiber, that you're supporting your liver and also supporting your gallbladder for the healthful removal of waste and hormone metabolites and byproducts of other toxins, etc., from diet or environmental in all kinds of different sources, is one of the ways that we can kind of keep that open pathway, so to speak, to eliminate not just the toxins that our body doesn't need, but also to keep bacterial levels at a good, healthful level. All right, so now let's talk about older people. As you get older, well, all of us, our hydrochloric acid in our gut, our stomach, starts to decrease, simply just as kind of part of the overall aging process. Hydrochloric acid is designed to help with keeping bacteria levels in check. So if you potentially have been taking a proton pump inhibitor medication at any point in your life, because you were diagnosed with GERD or reflux or acid indigestion, that could be something that maybe sped up the process a little bit. But also, just as we get older, our pancreatic enzyme insufficiency dwindles, and also our hydrochloric acid production dwindles, meaning that we have less of those natural reserves for combating pathogens and also keeping that bacterial balance at the upper part of the digestion more in check. So therefore, if the hydrochloric acid is lower, dealing with hypochlorhydria, that can basically allow the proliferation of some of the small intestinal bacteria, overgrowth colonies, to kind of come up and invade more in the small intestine. So age and gender can certainly both be really big factors. Now, getting a proper diagnosis of SIBO can be challenging, and this is where I always really refer my clients back out to an integrative medicine doctor or someone who's really a specialist in understanding the way in which SIBO needs to be tested properly and getting an accurate test result. So there are really kind of two methods. One is a microbial culture test, usually looking at stool, and I know that Genova has a couple of really good panels. I also like the GI map test by Diagnostic Solutions Laboratory, and potentially for follow-up, your physician may also suggest that you do either a hydrogen or methane breath test. Those types of tests usually are conducted maybe in a clinical environment or in a hospital so that they can monitor your breath output over a series of hours. And they just have you blow into a tube, and they're measuring to see what type of gas output maybe that type of wrong bacteria is producing out of your digestive system. Now, keep in mind that sometimes these tests can be a little bit inconclusive. I've certainly worked with a lot of people where their test levels kind of came back like right on the borderline, but yet they're very symptomatic. You have to be able to kind of test on the days when symptoms are maybe at their worst, or if you're a female, maybe testing near your menstrual cycle where hormones may be playing a factor, or certainly eating the same type of diet and doing some of the same types of lifestyle things that would be causing symptoms in order to get that positive test. Because as soon as you start working on regulating bacteria, maybe if you're doing an antimicrobial herb or you're changing your diet, well, that's going to make it harder to get that positive testing to know maybe what the best course of treatment is. So it's kind of good news, bad news, knowing that we can do a lot of the necessary holistic approaches that can really start to resolve symptoms. But if this is a chronic thing and you're starting to employ some of the natural methods, it may make it harder to know like how serious your case is and if you need to maybe be working with your gastroenterologist for an antibiotic treatment plan depending on, maybe what that looks like for you. So treatment and testing, there's a lot of basically, ways where we can kind of just look at, is it symptom based? Do we have, actual microbial cultures to look at? Do we have a breath test? And again, I would say that it's a really kind of a high relapse of people who maybe even take the antibiotic treatment, but then still have kind of recurring symptoms up to a year later. So, all right, let's get back to really what we're talking about. I don't want to go down that whole rabbit hole of sort of the confusion and some of the issues that can arise. But back to the correlations between individuals who have Hashimoto's and the individuals who have SIBO, I see this really frequently in my practice, almost to the point where I would say it's probably 50% of people that I work with who have Hashimoto's have SIBO as well. Now, I myself have never tested positive for SIBO, but I do suspect that there have been periods of time, especially because I had a pretty chronic antibiotic use childhood due to things like strep throat and gastroenteritis, which was really celiac disease. But because that was sort of the standard of care when I was, an adolescent and a teenager, I had a lot of antibiotic use that I think was one of the things that really sort of led to a lot of my symptoms around like IBS, diarrhea. Certainly it was the celiac as well, but this caused a lot of the changes in my gut that basically were kind of compounding probably some of the bacterial dysbiosis. The people that I work with where they present with really any sort of the digestive symptoms that I described, belching, nausea, bloating, gas, or like a distended abdominal section where it kind of, looks like maybe they're pregnant or something by the end of the day, and I can say this because I kind of know what that feels like, where you wake up and you feel normal, your gut feels normal, and then after you've eaten 2 or 3 meals, your belly is just really, really full, hard, and maybe even painful. That distended abdomen can certainly be a sign. So we don't always need the clinical testing to prove that a person has SIBO. We can really sort of work holistically and naturally with foods and lifestyle practices. So I'm going to be doing some additional videos on digestive issues that affect people who have Hashimoto's, as well as some of the dietary principles that we utilize. What I want to say is that if you've gotten this far in the video, first of all, thank you and congratulations. Hopefully you have more information than you had when you started, but be careful because one of the standard treatments from a dietary standpoint is to go straight to a low FODMAP diet for SIBO, and that does not often work with 100% guarantee for most people. It certainly can be a good starting point, and I'm going to talk about FODMAPs in an upcoming video and the ways in which this may complicate certain things, as well as potentially offering some benefit. If you think you have SIBO, I think the best thing that you can do is to track your symptoms in a journal. Keep a list of foods that you eat, pay attention to symptoms that arise throughout the day. Make note of when these symptoms are potentially at their worst, and also if there's a cyclical pattern, ladies, that maybe ties in with your hormonal changes, especially towards the end of each cycle, right before your period, you may notice some of the symptoms of SIBO getting worse. So today, the video is all about sort of assessing this connection, people with Hashimoto's and small intestinal bacterial overgrowth, and I will be back with more videos to explain some of the things that you can do to start resolving symptoms. Thanks for watching. I'll see you soon.